A demonstration for Acminf301 infection control activities. This scenario involves a small puppy named Lulu Patterson who has been diagnosed with infectious canine cough. I'll demonstrate correct infection control, safe handling and cleaning procedures during her hospital admission. So I've reviewed our workplace infection control and quarantine protocols. I am now going to wash my hands thoroughly and putting on my PPE, so that will be gloves, gown, mask and shoe covers. I've prepared disinfectant, towel, slip lead and clean isolation cage as well. Okay. Now that I've washed my hands, I'm going to now put on my PPE. Okay, first off, I'm going to do my shoe covers. Now I'm going to put my apron on, just making sure everything's covered. To place my gloves on. Making sure everything is tucked in as I'm doing it. And now I'm going to place my hair on. And making sure all parts of my hair are tucked in, as we don't want any connection with the dog. Just gonna pull that up. Okay, and that. I have now prepared the disinfectant, which I'm going to be using spray and white just as my first basis, and then I'll be using F10 in the 125 solution. And then I'm also going to use paper towels as my wipe, and then I will get my slip lead ready and then we'll go get the dog. So I have my slip lead with me and I also have a towel. I'm just going to be using this if I need to support the dog without touching her. And because she's small, I'm only gotten a small towel. And it's also to make sure if she coughs, I can quickly cover or just clean up any mess that's been made. And then I'll go back and cover it again. Okay, so I'm just going to walk up to the dog now and grab her. Okay, so I'm just going to have the slip lead. I have the towel with me on the side here just in case I need to grab it. I'm fully gowned up, so I'm just going to walk up to Lulu right now and just going to try and speak to her kindly. Just because she's smaller, I'm going to try and crouch down a little bit. Hi, sweetie. That's a good girl. Yeah, good girl. And then if I had a treat, I'd be getting it to her. Unfortunately, I don't have that today, but if I just speak to her calmly, and I did say she's quite friendly, so it should be okay. And I'm just going to place it over her head here. Hi, sweetie. Good girl. Just making sure it's just under her, nice and not too tight and not too loose. Good girl. Yeah. just making sure it's underneath her chin here. And now I'm going to lead her off into the area, and then we'll go from there. Come on, good girl. Good girl. Come on. So I'm just leading her on a shorter leash, just to keep her in control so she doesn't touch me. I'm just leading her to the kennel, so just have the kennel right over here, and then we'll just lead her there. So I'm just keeping her on a short leash, just so I can avoid her touching me and going near any other dogs. As I'm doing that, I'm just walking her straight to the kennel. Okay, so once she's secured in the kennel, I will just disinfect the lead and disinfect anything else that I've used to help with her. Just had it all set up for her here. So what I'll do is I'll just grab her, put her in there. Come on, sweetie, good girl. In you get, good girl, good girl. So I'm just going to take the lead off from her, and then go from there. So I'm taking it off. Make sure she's all secure in there. Making sure that I close the door before she gets out. Just making sure it's nice and secure. Give the door a little tug. She's nice and secure in there. So what I'm going to do now is disinfect the lead and then go from there. Okay, so she is all secured into the kennel now. So what I'm going to do now is I'm going to place an isolation kennel cough sign. I have documented her admission in the logbook. So I'll just quickly do that now and gather everything else that I need. I'm just going to place this on her door panel. It just says kennel cough on it, and it's only for no public or anything like that, just for staff members only. So I'll just place this on the window here, not to completely cover her, but just enough so you can still see that pretty obviously. Okay, so what I'm going to do next is write in a logbook. So I have the logbook here, have it here, so I'm just going to write in here that she's been admitted and then go from there. So blue, admitted today, kennel cough, and then we'll go from there. Okay, so what I'm going to do now is I'm going to go and disinfect anything that she's touched. So that will be the consultation table, the lead, towels, anything like that she's used. If need be, I can throw towels away, but I'll go do that now and I will show. Okay, so I'm just going to wipe down this table here. This is where she was examined. So I'm just going to use my first line of defense is spray and wipe with some paper towel. So I'm just going to spray it all down. I'll just move this lead to the side for the moment, and then I'll disinfect that as well. So I'll just make this, good nice bit of spray, and I'm just going to go around in circles. Making sure everything is quite tidy. Just going to go one more time. So that's just my first line of defense. It is completely wiped down. Every bit of residue is now removed with my paper towel. So what I'm going to do next is I'm going to mop in, and then what I'm going to do next is get my F10 and just spray it all down, and I'll let it soak for the required amount of time, which about 30 minutes roughly, just to be safe. If not that amount of time, just because we do get more clients in here, I'll probably just try and do about 15, but for this purpose I'll be doing 30 minutes. So I'll just quickly grab the F10. Okay, so I have my F10 here, so what I'm going to do is I'm just going to spray everything down, making sure it's completely covered, anything she's touched. So that is going to set for about 30 minutes, and then go from there. So I just let it sit for about 30 minutes, so I'm just going to wipe it all down now. Just going side to side. And then I'm just going to go this way. Just making sure all the residue comes off, just because it can burn animal's skin, just because it is quite strong, making sure I don't get any of it on myself as well. Okay, all the residue is done. I'm going to leave that to air dry for the remaining of the time, and now I'm going to remove my equipment. Okay, and now I'm just going to remove my apron, gloves, hairnet and booties. So what I'm going to do now is I'm going to remove them. First thing I do is I'm going to take the booties off, just because we don't want our hands to touch these. Making sure those are completely off. Now I'm going to chuck them straight into the bin. Okay, and the next step is taking the apron off. So I like to take it off like this, and then what I like to do is I like to clip it, and then just while you're pulling these off, the glove should just come off. If not, just tuck your finger under, and then take this bit, run your hand over, just under, and done. Okay, and then next we're going to take the hairnet off, and all done. So that's all removed, and then we're going on to the next step. So I've just removed everything, I've chucked it into the biohazard bin. So now what I'm going to do next is I'm going to inform the veterinarian. Okay. I'm just going to inform the veterinarian that's here with me. Okay. Finally, I'm just informing the supervising veterinarian that Lulu has been isolated, the area has been cleaned, and the equipment as well, including the lead and towel, disinfected. I've recorded all the infection control steps have been completed. This is my demonstration for Acminf301, maintain and monitor animal health and well-being. For this assessment, I'll be using a stuffed toy possum to represent a live animal, as I'm completing this in a stimulated environment. I'll demonstrate each step exactly as I would with real possum in care. Okay. Before I start, I've reviewed the workplace policies for quarantine, infection control, and wildlife. Before I start, I've reviewed workplace policies for quarantine, infectious control, safe wildlife handling, and I'm going to now wash my hands thoroughly, and I'll show that right now. Okay, so now I'm going to show you me washing my hands, just getting some soap on me, making sure it's all lathered up, get some water on there, just like to this. This is just to make sure every crevice gets in there. I like to do this with my nails, just so I can get anything that's underneath there. Okay, now that's all done, I'm just going to rinse off. Now that I've washed my hands, I'm going to put my PPE on, dry my hands first, then put the PPE. First thing I'm going to do is I'm going to put my booties on. Just making sure it's covering my whole sole, just so we don't want anything on my shoes. Just also wearing enclosed shoes as well, just because we don't want anything to get on our skin. So now I'm going to put my apron on, as you can see here. Just make sure it's the right way. Just place it over, hands in, sleeves. And just making sure I'm tying it. Just make sure it's completely wrapped. Okie dokie. Now I'm going to put my hairnet on, as you can see. Making sure all hair is tucked in. Making sure nothing is showing. Okay, I'm getting some gloves on. Making sure everything's tucked in, nice and sealed, so no skin is exposed. Okie dokie, now I've all covered up, as you can see, all covered up. So now I'm going to go over to get the possum and go from there. I've got my PPE and I've washed my hands and I've gathered my equipment, which is a sample jar, a thermometer, and I'm going to use my fingers to test for a heartbeat under the armpit if the animal allows me. I also have a box to place the animal in, so I'm just going to put a towel in here and then gather another towel to collect the animal and place it in the box. So it's safe and calm and quiet for the animal. Okay, now I have put a towel in the box. I've gotten the towel to gather the animal with, so I'm just going to place those aside for a moment. Now I'm going to prepare the enclosure, so I will set that all up. So what I'm going to put in there is a bowl with some food, another bowl with water, making sure there's some blankets and towels on the bottom. There is shelving in there, so I don't have any branches, but if I had a branch I'd be placing that in there. So I will do that now and I will show you. Okay, so I got some towels in here. I have some towels and I have a bowl of water and some food. I do have some toys for the possum just in case it wants to play, and I'm going to place in a couple more towels and some more like little hidey holes up here, so I'll just do that now. So what I'm going to do now is I'm going to place, when the possum's in here, I'm going to make sure I put the box in there as well so it has a hidey hole to hide in, and then I'll be putting in some more towels and blankets just so it has lots of warmth, and I will be placing a hot water bottle in there as well. Okay, so there's fresh water available for the possum. I'm going to record that in the environmental book, so it is acknowledged what's in here for the possum and what to put in next if we need to replace any of it. Okay, so I have confirmed the possum's identification, completed the animal details section, and I'm going to use a towel to get the possum. Okay, so I have the possum here, so I'm just going to be really quiet and I'm going to gather the possum in the towel. It is quite calm at the moment, so I'm not going to be stressing too much about it. So what I'm going to do is I'm going to slowly put the towel over the possum just to keep it quite calm. It's nice and dark in here for them. So I'm just going to gather him up in the towel very gently, very gently. So what I'm going to do next is I'm going to put him in the box, making sure I'm keeping him nice and close to me, hand under his belly just so I can secure him, keeping his body nice and tight. Okay, so I'm just going to place him in the box now. So I'm just going to do like this. And I'm just going to open the towel up for him to go in. There he is. Making sure I'm keeping my hands nice and far away from his face, so just in case he decides he wants to bite me. Okay, he is now secured, so I'm just going to close this box just so we can get in there better. And he's nice and secure. So he's nice and secure. He's only going to be in here for a short while, so there is an air hole here. I'm just going to give the blanket a little cover as well, still giving him enough air to get in. So I'm just going to transport him into the kennel, into his enclosure now. So I'm just going to keep the movements very slow, calm, just so I don't disturb him too much. So I'm just going to slowly walk around, just crouching, keeping it very quiet. Just crouching and keeping it very quiet, making sure I don't do too many movements. So what I'm going to do is I'm just going to open this box up. So I'm just going to place him up just at the bottom here. And before I let him out, just keeping it nice and secure, I'm just going to quickly put this towel on the top shelf here, just to get some warmth. And then once he's out, I should be able to just quickly cut. So I've just placed him in here now. So what I'm going to do is I'm just going to open the box. I'm going to grab him out with this towel, and I'm just going to grab him out of the box, and I'm just going to put him over on the side here. So still covering him, keeping my hand just in reach, just so I'm able to grab him if I need to. And then I'm just going to put the box on the top shelf so it has somewhere to hide. So I'm just doing this very slowly, very calmly, not to freak him out, making sure I get the towel, just opening the box a little bit more, just keeping it nice and quiet, nice and slow, just grabbing him out of here, keeping him nice and tightly wrapped, not too tight, but just enough where I can see him. I'm just going to cover his head a little bit just so I'm able to just quickly put him on the ground and he doesn't outside the body. Just keeping him nice and secure there. So I'm just going to leave him right there. I'm just going to keep my hand lightly on him, not putting too much pressure, but just enough where I'm able to keep him in control. So I've just got the box here now with the towel. So what I'm going to do is I'm just going to place it up here so he has somewhere to hide. I'm just going to just like that, and then he's able to climb up there and hide in there, and I'll just put some other stuff in there for him if he needs it. So what I'm going to do is I'm just going to quickly take this towel off, just slowly, just closing this door while I undo him. So he will just move around, move over there, and he is now all done. Just keep making sure the door's locked and nice and secure for him. Lots of air ventilation, he has plenty of food, water, fresh water, and lots of hidey holes for him to hide in if he needs that. Okie dokie, now I'm going to do a health check on the possum today, so I'm just going to make sure he's generally overall is healthy. If I'm able to, I'll do a thermometer check, so just checking his temperature, and I'll get a poo sample from him as well, just to make sure he is completely good, and then go from there. So from what I can see, I'm just going to grab the towel just to make sure, not to make him too stressed, just doing slow movements, just grabbing him nice and secure, just giving him a little tight around, just making sure he's nice and secure. So now I'm going to check his eyes, his nose, his mouth. So from overall, his coat is quite nice. It's nice and healthy, looks shiny. His eyes are nice and bright. His nostril is free from discharge, so no signs of anything of like the flu or anything like that. So I'm just going to take his temperature. So I'm just going to take his temperature now, just putting it, pressing it up his rectum. Okay, so his temperature is 36.8, which is pretty good. So nice and good there. His temperature, no fever. Okay. Okie dokie. So I'm just gonna check the just the heart rate of the possum. So get the possum's heart rate now. So I'm just keeping my hands away from its mouth, just keeping it not too tight, but just enough where I'm able to have control of the animal. So what I'm going to do now is I'm going to place my fingers just underneath its front legs, making sure my hands are completely safe from the animal. So I'm just going to place it under here, and I'm just going to count for 15 seconds, just be a moment. Okay, so I'm just going to times that by 4, give me a second. Okie dokie, for the heart rate, it's at 180 BPM, so that's pretty average for a possum. Just for the size of it, pretty typical for it, so it's quite healthy with its heart. So I'm just going to check its breathing now. So I don't have a stethoscope, so what I'm going to do is I'm just going to place my hands on its chest, and I'm just going to have a quick feel for its heart rate. I'm just going to check for its breathing. So I don't have a stethoscope at the moment, so I'm going to observe the possum's chest for rise and fall movements. And I hold my, also if I can and if it's safe, I'm going to hold my hand close to its nose, not too close, but close enough where I can feel the breath, and just count, sorry, excuse me. And I'm going to feel for the warm airflow to confirm it's breathing normally. So I'm just going to calculate that, and then we'll see how it is. Okay. So I'm just going to observe breaths. Okay, and I'm just now going to observe with my hand, just keeping the animal just nice and secure. So I'm just going to tighten it up a bit so it doesn't get loose. So now the head is secure and it's not going to get anywhere. I'm just going to check its breathing now. Alrighty. Cut. Okie dokie, so now I've tested the breaths, I've done the calculations, so it's at for breathing, it is at 40 BPM, so, and I would like to check its mouth, but I don't think it's quite safe to do that, but I will attempt. So I'm just going to keep its head secure, just keeping my hands just around its neck, not too tight, but just enough so I'm able to handle it correctly. Just going to lift up its gums. Yeah, I'll just do a quick test. Yeah, okay, so the mucous membrane is pink, so that is good. It's reacting pretty fastly, so it's about 1.5 seconds. And overall the possum is alert and responsive to everything that I've done soon. Quite calm still, so it's nothing to be worried about. So what I'm going to do now is I'm going to, under the supervision with my, cut that. What I'm going to do now is I'm going to apply tropical parasite treatment suitable for a 1.2 kilo possum. So I did weigh, she was about that. So I'm going to grab that now and I'm just going to apply it between its shoulders. So what I'm going to do is I'm just going to try and cover, keeping a hold of it, just going to cover its head so it keeps calm, and just kind of try and make sure I can get in there. So I'm just going to do that now. Cut. Okay, so I'm just going to apply the treatment here, just along its shoulders, just doing this. Perfect, okay, so just keeping the possum nice and secured, just quite tight, not too tight so it can't suffocate, so cut. So now I'm going to place it back into the cage for it, and then I will get a fecal sample from it with my jar. Now it has to be high up. Oh fuck. Okay, just keeping the possum nice and close into the towel, just so it's nice and safe for me to hold it. Just keeping it nice and close. Just going to place it into the area. Just going to let him get out of the towel. Just keeping his head away from me. So now he's all nice. I'll leave this towel in here for him. Just going to quickly close the thing and making sure it's nice and secure. So he's nice and safe in there now. I'm going to gather a poo sample. Cut that. So now I'm going to get a fecal sample for him and then go from there. Thank you. Okay, so now I have my protection on. I've got my gloves, my apron, and my mask here, just to protect me from Giardia and any spread of the disease. So what I'm going to do now is I'm going to carefully move Ringo into his, away from the cut. So I'm just going to move Ringo into a isolated area just for now until I can move him into the kennel while I'm cleaning up the infected area. So I just have with me a slip lead. So what I'm going to do is I'm just going to put this around his head. He does seem pretty friendly, but I'm going to remain calm and quiet and relaxed with him while I attend to him, because he is probably a bit uncomfortable in this situation. So just going to slowly approach the animal. Hi Ringo. Hi Ringo. So just placing a lead over his head. He's been very calm with me, very good. So I'm just going to wrap that, just slip that around his neck. Not too tight, but just tight enough that he won't be able to get out of it. So he is quite contained now. So what I'm going to do is I'm just going to lead him to an isolated area until I can get him into the kennel. Come on, Ringo. Okie dokie. Okay, so now that Ringo is nice and isolated for the moment, what I'm going to do is I'm going to clean the area. So I'm just going to get normal disinfectant and then paper towels, clean up as much as I can from the mess, which that will probably happen. So I will show you what I'm using. Just a moment. So I'm just going to use spray and wipe here. Just a simple disinfectant and just some paper towel. So I'm just going to spray it now. I'm just going to move the sign over to this area just because all the clients have moved over to this side. So sorry, let me adjust. The area is blocked off with that. So now I'm just going to spray the contamination. So sorry, let me readjust so you can get a good view. I'll bring you down here. Okie dokie. So what I'm going to do now is I'm just spraying and just cancel. Okay, so I'm just picking up all the spraying and wiping and collecting all the feces off the ground. So just giving a pretty simple spray, just giving a good wipe, making sure nothing gets away. And if I need to use more paper towels, I will, which I will, so give me a moment. Okie dokie, I'm just going to cut. Okie dokie, so I'm just going to chuck the rest of this into the bin, just next to me right here. Okay, so I'm just going to keep wiping, making sure everything gets tidied up, all organic fecal matter, and then placing that into my bin here, so that will be chucked out. So that is a just where we put all the organic matter. Okay, so I'm just going to give it one more quick wipe, just a moment. Just one more wipe, and then I'll go in with F10, which I'll grab that in a second. Okay, so I'm just going to grab some F10 just so I can properly sanitize this, so it's completely sanitized, so the disease dies and isn't still active. Okay, so what I'm going to do next is I have some F10 here. It's just the 125 dilution. So I'm just going to spray the contaminated area, just making sure it's completely sprayed. And then I'm just going to wipe it all down, making sure I'm kind of doing some 8 figures just so it's keeping it somewhat in the same area. Okay, so now that is all cleaned up, I will just give it one more wipe just to be sure. Yeah. Okie dokie, so now I've just chucked that into the bin. So now I'm going to make sure everything else is disinfectant with the 125, so that is. So now I'm going to dispose of, cut that. I'm just going to dispose of my apron, gloves and mask now. Thank you. Okie dokie, so I'm just going to remove my apron and gloves. So what I'm going to do first is I'm going to remove my apron, just untying this and just breaking this so I'm avoiding putting it over my head. Just slowly pulling this off. The gloves should just roll straight off, but if you need to, just tuck your finger. And then do the same side, making sure you're only touching the inside of the apron. Tucking my finger underneath in the inside of my glove. And just pulling the rest of it off, just making sure it's completely ripped. Getting a bit tight up here. All done. So now I'm going to dispose of it in our bin. And then what I'm going to do next is take my mask off. So I'm just doing this. And all done. And that's nicely disposed of. So now that this area has been safely disinfected and has been made safe, I'm just going to let the clients know what has happened. Hi, I just wanted to let everyone know that the dog in the waiting room may have had a contagious intestinal parasite called Giardia. We followed all the full infectious control cleaning procedures, and we have disinfected the area. As a precaution, please wash your hands and please do not let your pet lick the floor, or if it starts showing any or any other surface that has been affected. If your pet shows any signs of diarrhea, vomiting, please contact your vet straight away. Thank you. Now that I have completed that, I'm going to document the incident and the infectious control log. Cancel that. Now that I've completed that, I'm just going to document the whole incident into the infectious control log, including the animal's ID, clinical signs, actions taken, and the staff involved. I'll notify my supervisor and monitor the isolation area for any further contamination. This is the Ringo Jones dog scenario. So I'm just in the waiting room for the animal shelter. So recently the dog has passed bloody diarrhea on the floor. So I must isolate him and disinfect the area while keeping staff, clients, and animals safe.